I guess my story just begins with high school, having really awful periods. And I had an OBGYN, and she would listen to me every year complain about how I had really bad cramps, how I was taking a lot of Advil. And so she never told me once about endometriosis, what the symptoms were, or worse, what the repercussions were if it went untreated.
So endometriosis is where the cells which line the uterus and are shed during the period are found outside the uterus, implanted on the peritoneum. I call that the wallpaper of the pelvis. And that causes two main things, pain and can affect fertility. Now most people treat it by just burning it, for lack of a better word. They're trying to destroy the implants with energy. The problem with that approach is it can be widespread. It can go deeper, so you might just be charring the tip of the iceberg and not get down to the bottom of the lesion. Or it can be on or near a vital organ. So we cut it out. If it's a large patch, we cut around it. If it goes deeper, we cut under it, under the roots, so to speak, to get the whole thing out down to normal, healthy tissue. So Mary had had a couple of previous surgeries by ablation, but I think there was a recognition that there was endometriosis that they couldn't get to, that they didn't feel comfortable treating by ablation. She still had persistent pain even after the surgeries, and she was trying to get pregnant and could not get pregnant.
We decided as a couple that I would go off birth control and we'll see what happens. And nothing happened. And so it was really disheartening, and just month after month of it, of just not being successful was very difficult. And when Dr. Young did the surgery, I went in and I was out just over an hour later.
We try and do the surgery minimally invasive, so it's laparoscopic or keyhole surgery. Again, a hole in the belly button that we try to bury or hide in the belly button, and then two down low in the bikini line so that there are no visible incisions in the mid-abdomen once they're all healed up. And I use a non-contact laser as my cutting tool of choice to cut it out. So that allows me, it's very precise, it cuts one layer at a time. I don't have to touch the tissue, so there's not that danger of pushing too hard. But that allows me to scallop off endometriosis off even things like vital organs.
They made sure that all the organs were there and working properly, and he sent me home and said after my follow-up appointment that I could start trying to conceive, I guess about 6 weeks after the surgery. And sure enough, before we even started really trying, we discovered we were already pregnant. So went through the whole 9 months of pregnancy, and now we have a baby girl.
I really believe that endometriosis is underdiagnosed and undertreated. It's thought to be in 1 in 10 women and can take up to 12 years to diagnose. And to take care of a patient who has had years of pain, poor quality of life, and do a procedure or do a surgery that can help them feel better, have better quality of life, better relationships, be able to get pregnant. I'm gonna steal a phrase from my wife and say, those things have eternal value. And so to do something that can really change their life or lead to a new life is just awesome to be a part of.